Hi, everybody. Good morning. My name is Ricardo Cabrera. I am the director for the Latino Chamber of Commerce of Boulder County. And today we're going to be talking with Sebastian Cifuentes, who is representing the Department of Health and Housing Services here in Boulder County. And he's been working with them for years. I met him, I don't know, 4 or 5 years ago. And he is one of their health coverage specialists. And hopefully he's going to help us learn and understand a little bit about what Housing and Human Services does. So with that, Sebastian, tell me a little bit about yourself.
Hi, Ricardo. Thank you for the opportunity. Thank you for the time. So yeah, I'm a health insurance specialist with Boulder County Housing and Human Services. I've been working for the county for almost 7 years doing this. In my office, my team specifically works helping people navigate the healthcare system and letting people and providing people information about the different programs that are available through the state, such as Medicaid, CHP Plus, which is a program for children, and Connect for Health Colorado. So we help people apply and evaluate their situation and see if they qualify for assistance or tax credits through the Obamacare system or Connect for Health Colorado, which is the name of the marketplace here in the state.
Excellent. So if I understand correctly, the Housing and Human Services, they're kind of like a consultant for the community, so people can go there and ask and find out what options they have, health options for municipal, county, state, and even federal options, and you guys can help them understand and pick the right one for them. Is that right?
Yeah, my office is specifically focused on those programs. I mean, under the Housing and Human Services Department, there are other, different teams that, and we provide different services, right? And different programs, housing programs. People can apply for food assistance.
All right. So like financial services and, consulting and, how to do a balance sheet, or not a balance sheet, but a budget and stuff like that. So,
exactly.
So, correct. So the Health and Human Services office has several different services they provide. You guys in particular do health care and health insurance consulting.
That is correct. Yeah, we provide all that information to our clients and evaluate their situation and see what's the best option for them in terms of health coverage.
Excellent, good to know. I know I have used you guys, and you guys are incredible. I came out the first time I met you guys with a very good opinion of your service and everything, and I learned a bunch on that day, which was a long time ago. But anyway, Sebastian, let me ask you about this. I recently learned that you guys have something called Emergency Medicaid, a program that's been around for a while, but it's still there now, and it has some COVID parts to it now. So can you tell me more about that?
Yeah, when it comes to this specific program, which is called Emergency Medicaid, which is not regular Medicaid, for this program, so this program is available to anyone in the state, regardless of your immigration status. So anyone who is in an emergency situation can apply for this program. Usually the process starts at the hospital where you are getting medical services or emergency services. They usually complete the application for you if you are uninsured. Then those applications are sent to the county where you live in for processing. So yeah, but there is another option if for some reason you had an emergency, but nobody completed the application for you, then you can always come to any office, get an application, complete the application and submit it. Or you can do it online. This feature has been added to the online application, which is called Peak. And you can request the coverage through that system. Along with the application, you need to, there is a form that the provider who saw you needs to fill out, explaining the situation and what happened during that visit, in order for the technician who's going to be reviewing the application, so they can determine if you actually are eligible for the program.
Okay. Okay. So in this program is is this program available to everybody, regardless of migratory status?
Yes, it's available to anyone who is uninsured. And one thing that I want to point out is that this is not subject to the public charge test. So anyone can apply without, I mean, if anyone, as I said, if anyone's in this situation, in an emergency situation, they can go ahead and apply, and this shouldn't affect your chances of changing your status in the future, if we are talking about specifically to the public charge test.
Oh, that's good to know, because a lot of people worry about that. So Sebastian, let me ask you, this is being a Medicaid program, it's income-based, right? So not really everybody that's uninsured qualifies. You have to be under a certain income level?
Correct. The criteria is the same for regular Medicaid and for this program. So yeah, it's going to be based on your household composition and your income as a household. So yeah, they are going to take into consideration those, your income for sure. Yeah.
Excellent. Well, that's great to know, Sebastian. So why don't you tell us, let me point out that behind you there, we have information on where they can contact the Housing and Human Services Department, right? You have a phone number, you have an email address, and the website, of course, is bouldercounty.org. So email, I hear email is better than a phone right now. Is that right?
That is correct. Yes, given, the times that we're living in, we're very busy. So the best way to get in touch just is through email, I would say. And somebody should get back to you within 24 hours. So yeah, send us an email. I think that's the best way to get in touch.
Okay, well, great. Sebastian, for now, let me just say one more thing. We are going to have a full webinar on the health and human services, housing and human services, health services on June 17th. It's going to be a full hour with Sebastian. We're going to be live. We're going to be taking questions. You can find this webinar on our Facebook page. It's going to be live, broadcasted live there, or on here on our website. You can go in there and register to get the Zoom information. So please do so if you want to hear some more and ask Sebastian some questions. But for now, thank you so much, Sebastian, for your time and great information. And until next time.
Thank you.